Hi, my name is Denise. What's your name?
Jake.
Jake, nice to meet you. I'm going to do a physical assessment today on you, if that's okay. We're going to cover your head, your eyes, your nose, your mouth. I'm going to do a little bit on your neck as well. So if that's okay, we'll proceed.
Sounds good.
Okay. So, Jake, in looking at your head has symmetry. It's equal. It's round. The skin on your face is white. You have some pink tones. Your skin is well hydrated. There is no dryness. A little bit of oiliness on the forehead down into the nose area. The texture is smooth. And you have a thick head of hair, and your hair is soft, it is full. In looking at your scalp, there is no flaking. There are no lesions that I can feel on your head, in your scalp. No lesions noted on your face, on the back of your head. No lesions on the neck area. The neck, it has good symmetry. Looking at your lower extremities, the skin is warm to the touch. You have a good amount of hair on your arms, the same texture as on your head. I meant to mention too, you also have facial hair that is the same texture as the hair on your head, well distributed, no balding spots on your face. Skin has good turgor. Hands are warm to the touch. No lesions noted on the hands. Capillary refill is immediate, within 1 second. Looking at the lower extremities, hair again on your legs as on your arms. No lesions noted on your legs. Skin is warm to the touch. No lesions. No varicosities on your feet. Skin looks to be white. No bluish tones. Nail capillary refill on your toenails are the same. No fungus noted or discoloration of the nails or the toes. Okay. Jake, I'm just going to go back to your face again. I just want to check some of the cranial nerves. I want to look at the movement in your face. So can you just, first of all, open and close your mouth. Good. Now this is cranial nerve number 5, trigeminal, and cranial nerve number 7. That would be your facial that I'm going to be testing. First with the movement of your jaw, cranial nerve number 5. I just want you to clench your jaw. Good. Open and close your mouth again. And I'm just checking for any clicking sounds. Now when you open your jaw, keep it opened, your mouth, and move your jaw side to side. Okay, good. And again, there's no clicking noted. Okay, great. Now can you smile? Good. And frown. And blinking your eyes. Great. Okay, and all those nerves are intact. And I think we're done with that. I just wanted to feel again around. Okay, good. So you have good movement and those nerves are working well. Okay, Jake, now we're going to test your eyes. I'm going to do a few tests just for visual acuity, which is your cranial nerve number 2, that's your optic nerve. And then we're going to do some other ones just testing your extraocular movement with your eyes. So we'll start with visual acuity. And do you wear glasses or contacts, Jake?
Yes.
And you're wearing your contacts right now?
Yep.
Okay. And so we did the Snellen and the Rosenbaum test already, which you passed. And that tests for both nearsighted and farsighted. And we did that both with your corrected lenses on your glasses and then uncorrected. So those both are done. I just want to test your peripheral vision right now, something called confrontation. We'll do a test on that. I want you to cover your right eye, okay? And I want you to follow this. Not follow it, I want you to actually tell me when you see it in your periphery, okay? So I'm going to cover my eye as well. And you tell me when you see it.
I see it right there.
Okay?
I see it.
Good.
I see it.
Okay, so we're going to do the opposite eye now.
Okay.
Let's try it again. Tell me when you see it.
Right there. Right there. And right there.
Okay, great. Okay, now we're going to test your extraocular eye movement. Okay, I'm going to do a couple of tests for this, and I'm going to start with my pen. I want you to follow the tip of my pen light.
Okay.
Good, okay. And here's another one again. We'll start here. Good, and that was the wagon wheel and the H, which you did fine. Okay, now I want you to gaze at the back of the wall there. And I'm going to put my pen light close to your nose, and I want you to take your gaze from the wall onto the tip of my pen light. Good, and back to the wall again. Okay, great. And now I want you to look straight ahead. I'm just going to check your pupils. Good, and just continue to look straight ahead. Okay, that's great. Okay, so those are done. I'm now going to have just an inspection of your eye, and I might feel your eye as well, just to have, make sure there's no tenderness, and then I'll look inside your eyes, okay? So upon looking at your eyes are symmetrical. Your eyebrows are full and thick. Your eyelashes are full and they extend upward. Your eyes have symmetry in relationship to the ear and to the side of the face. Both look good. Your pupils are round, both round. They are reactive. And Jake, just close your eyes for me. Okay, I'm just going to have a feel. Okay. Your lacrimal sac, I am just pushing on. Any tenderness?
No.
Good, and I'm not feeling any bulging or lesions. Good, and then just open them again. Good, and both pupils are reactive to the light and consensual, so that's great. Now what I'm going to do is I'm going to have a look inside your eye, okay?
Okay.
Okay, Jake, I'm just going to have a look inside your eye. We already checked red reflex, and so I would be standing about here, turn off the lights of the room, so it was a dark room and I was able to see the red reflex by looking at this point. So now I'm going to look into the eye. What I want to observe is your the eye structure, the optic, the nerves that lead into the optic disc, and then other structures in the eye. Okay, good. So in using the ophthalmoscope, I was able to see and visualize the optic disc. There are vessels, healthy vessels that lead into that. I could see them. There were no constrictions. I didn't see any lesions or bulging. And the optic disc is about 1.5 millimeters, and I saw that. There are numerous blood vessels that exit the optic disc, and they lead into the macula. In the macula, the macula is a darker circle right in the middle, and that's where a lot of the central vision is. From there, there's a fovea centralis, and that's a small white spot in the middle of the macula. And all of that looked normal and healthy, and again, there were no constrictions seen from those blood vessels as well. So we were able to note all of that. So from there, we are going to look at the ear and inspect the ear on the inside, and I'll go from there.
Okay.
Jake, I just wanted to also say that in looking at the retinal background, there was no exudate or hemorrhages noted when I was looking in your eyes. Okay? So now I'm going to have a look at your ears. I'm going to inspect them. I'm going to do some palpation, just touching them, making sure nothing is tender, and then I'm actually going to look in them. We'll probably also do a hearing test as well, and that's just to test your cranial nerve 8, and that's the acoustic. In looking at your ears, they are symmetrical, they are equal in size. The helix is malleable, it comes down. Do you feel any pain here with
No.
the tragus? Okay. And any pain here behind your ears?
No.
Okay. And how about here?
None.
Okay, and that's just the mastoid area. And I'm just inspecting your ears. I don't see any drainage coming out of them. They don't appear red. They're the same color as your face and your neck. Do you have any hearing problems? Do you feel like your hearing's gotten worse over the past few years?
No.
Okay. I'm going to do a couple of tests. One right now is the whisper test, okay? I want you to cover this ear, actually plug it for me if you can. Okay, and I'm going to say something. Could you hear what I said?
Yes.
And what did I say?
You said, "Hey Jake, how are you?"
Okay, great. That's excellent. And then I would repeat it with the other ear as well. And that's okay. You've already
Okay.
done that. So that you would do that bilaterally. Okay, great. Now I've got a couple of tests that I want to perform. Something called the Rhine test, okay? So I'm going to strike this and I'm going to put it behind your ear, and I want you to tell me when you stop hearing it, okay?
Okay. I stopped hearing it.
Okay, and do you still hear it now?
Yes.
And tell me when you stop hearing it.
I stopped hearing it.
Good. So that will test your conduction and your air conduction versus your bone conduction. And so you were able to hear that longer with the air conduction, which is good. That's 2 to 1 usually. And that's roughly what you were doing. So that's great. The next one is called the Weber test. I want you to tell me if you can hear this sound equal in both ears. I'm going to place it on the top of your head, okay?
Okay.
Can you hear the sound in both ears equally?
Yeah.
Okay, good. And so that's good. If you were to have sound in one ear more than the other, there may be some hearing loss in the ear that you weren't hearing it as well. So that's great. So those 2 tests are done. Okay, Jake, now I'm going to look on the inside of your ear to make sure everything is healthy and in place there. So I'm going to look on the right side first, pulling back on the pinna. I'm going to look into your ear. Good, and the external canal has no redness. There's no inflammation. I'm not seeing any discharge. Visualization. Okay, good, and I can see the tympanic membrane, which is clear. I'm not seeing any bulging of it, and in behind the tympanic membrane, I am seeing the malleus, the umbo, the pars tensa, and the pars flaccida, and everything is noted and in place. I also see the cone of light on the right side. That was at 5 o'clock, and the cone of light on your left side was at 7 o'clock. Okay, so now the ear is done, and we're going to go move on to the mouth. Okay, I'm going to use my pen for looking into your mouth. So if you could just open your mouth, good, and stick your tongue out and say ah.
Ah.
Great. And on inspection of your mouth, your oral mucosa is moist. Your uvula goes up and down. Okay, Jake, so the ear's done. Now we're going to inspect the mouth area, and I'm going to also have a look inside as well, just inspecting and palpating, okay? So in looking at your mouth, your lips are symmetrical. Can you just open your mouth a little for me? Good. Looking into your mouth, I see that your oral mucosa is nice and moist, and your gums are red. Now earlier I had put my gloves on and had an inspection in there, and you have 32 teeth, all white, a couple of fillings noted. I was able to inspect the Wharton's duct and feel and palpate that, and palpate the upper duct, the Stenson. There are no ulcers or no lesions in the mucosa. I was able to feel around, and the frenulum is in place both in the lower area and the upper. Can you just lift your tongue for me? Good. Can you bite down? And bite again? Good. And open your mouth again? Good. And okay, Jake, thank you so much for letting me do that. Now we're going to inspect. I'm going to have a look at the nose and test that cranial nerve, which is cranial nerve 1, that's the olfactory. And so, if you don't mind, I'm just going to have a look. Your nose is symmetrical. It's the same color as your face. I don't see any lesions on it. A few macules, just I can see that are not together, but diffuse. And then in looking into the nose, I'm just going to bring your nose, the tip of your nose up with my fingers. Are you okay?
Mm-hmm.
Okay. I see that the nares are symmetrical again. They're not deviated. The septum is symmetrical. The inferior turbinate is noted. The superior I am not able to see. No active bleeding or discharge noted as well. Okay, great. And then you can put your head down. I'm going to just make sure that both nares are patent. So if you take one side of your nose and just press that down, can you breathe through the other side?
Yep.
Can you do the same with your other side for me? Good. And now we're going to just test your sense of smell.
Okay.
And so I want you to close off one side of your nose and close your eyes. Great. And I just want you to tell me what you're smelling.
Onion.
Okay, great. And keep that closed. And then I have another one here that I want you to have a smell of.
Cinnamon.
Yes, okay. Great, and you can take your hands off. And then Jake, I just wanted to take note of cranial nerve 9, 10, and 11, and both the glossopharyngeal and your vagus all have to do with your gag reflex and speaking, and then your hypoglossal cranial nerve, which is 11, that has to do with the movement of your tongue, which you were doing very well. So that concludes the mouth part. And now I just want to have a look at your neck. I'm just going to have an inspection here and palpate. And what I'm doing is I'm just palpating your nodes. You have a preauricle and a postauricle node and a retropharyngeal. And then I'm just following with the clavicle. Any tenderness or pain there?
No.
Okay. So these are the anterior, superficial, deep, and posterior cervical chains, and they're all nodes, and I'm not feeling any. Good. Okay, and your neck is symmetrical, and I'm just looking at and feeling your spinous process, and then the vertebral muscles, and just feeling for any kind of bulging Again, is there any tenderness, any pain?
No.
Okay. You also have some cranial nerves 11, which are spinal accessory nerves. I think I said 11, didn't I? The 12 is your hypoglossal. I think I had mentioned that to be 11. Hypoglossal is 12. And so now we're looking at your 11 spinal accessory. Can you just resist my hand? I'm going to push down. You shrug your shoulders for me.
Okay.
Good. And then can you turn your head from side to side? Good. So your range of motion is great. And if you put your head down on your chest, and then if you bring it back again, good. Okay. Jake, I'm going to now just inspect and palpate your trachea along with your thyroid. Your trachea is just located above the clavicle bone, just to the lateral of the sternomastoid muscle. And if I palpate higher, I can feel the cartilage, and just below is the trachea. I'm not feeling any bulging or distension. And I do want you just to have a drink of water for me while I palpate it. Good, and I can feel that. And I want you to do that again. I'm going to go a little bit above there where the trachea is, and I want you to drink the water again. Okay. And there is no bulging when swallowing or displacement noted. So that's great. And one final thing, I'm just going to have a listen to both the carotid artery. I feel a pulse there, and I'm just going to listen for a small blowing sound or swishing sound, a bruit, which I do not hear. And then again, I'm going to listen for a bruit in the trachea area. I'm going to use the bell of the... And I'm listening for a swishing or a soft blowing. And I don't hear that as well. Okay, good. Thank you, Jake, so much for letting me assess you today.
You're welcome.
You take care.